Well, back in January, the World Health Organization published the 10 threats to global health in 2019. And one of these threats is going to be today's topic of the show. And if I scan down here real quick, that's dengue fever. And of course, dengue is a mosquito-borne disease that causes flu-like symptoms and can be lethal and kill up to 20% of those with severe dengue. And this has been a growing threat for several decades now. And it says a high number of cases occur in the rainy seasons of countries like Bangladesh and India. Now, its season in these countries is lengthening significantly, and the disease is spreading to less tropical and more temperate countries such as Nepal that have not traditionally seen the disease, and we are seeing some of that this year. And then just a little bit of background on the scope of and the size of dengue. It says dengue is one of the fastest spreading mosquito-borne diseases. Worldwide, the incidence of dengue has increased 30-fold over the past 5 decades. Dengue is a major public health concern as it can develop into a potentially fatal form called severe dengue. Of an estimated 2.5 billion people at risk for dengue globally, about 70% live in Asian Pacific countries. Climate conditions, unclean environments, unplanned urban settlements, and rapid urbanization can lead to increased mosquito breeding, especially in urban and semi-urban areas. And I don't have any hard numbers on the Indian subcontinent for the first 6 months of this year. However, we do know there's a lot of dengue in these countries. And even this year, we do know that the number of dengue cases in Bangladesh, particularly in Dhaka, is up pretty significantly. And we're seeing cases, of course, in Pakistan. And Sri Lanka, of course, is reporting quite a bit of dengue again this year. Don't have any hard numbers on India. However, we can just go back to a study in the Lancet Global Health a couple years ago. And based on their modeling, the researchers estimated that during 2017, about 8.8 to 12.9 million primary dengue infections occurred among individuals aged 5 to 45 years from 30 Indian states. Now, assuming that 25% of these infections were clinical in nature, the number of actual clinical infections from these 30 states is estimated to be around 2.2 to 3.2 million. A lot of dengue in India. Then if we look to the Americas, where we have some hard numbers for this year, several countries are, well, the Americas as a whole is reporting significantly more dengue cases this year than last year, and especially in the first 6 months. And certain countries are hit particularly hard this year, and we see that Colombia is reporting, Colombia is reporting about, let me get the right year here. Okay, let's try this again. Colombia is reporting about 51,000 cases this year so far in the first 6 months. We see outbreaks in several of the Central American countries, right? Honduras, that's been pretty heavily reported on this year. Mexico, Nicaragua, 36,000 cases so far. And then if we go to the Caribbean, it's not as bad as the other areas of the Americas. But then we go down to the southern cone of South America. And of course, when you think of dengue fever in the Americas, you think Brazil. And so far, Brazil's seen over 1.1 million probable and confirmed cases of dengue fever, which includes 366 fatalities. Overall, the Americas is up to about 1.3 million probable and confirmed cases of dengue and almost 500 fatalities. In Southeast Asia, we're also seeing increases of dengue so far in 2019. In Cambodia, we're seeing an upward trend since the beginning of the year. Laos is also reporting increasing amount of cases during the first 6 months. Malaysia, during the first 6 months in Malaysia, we've seen 62,000 cases and almost 100 fatalities. This is basically double what we saw this time last year in Malaysia at 32,000 cases and about 50 fatalities. The Philippines is also reporting higher than normal amount of dengue cases this year at about 92,000 cases and almost 400 fatalities. And this is, again, is nearly double this time last year when there was about 50,000 cases and 275 fatalities. Singapore is also reporting more cases this year than it did in the past 2 years. In Vietnam, there's been about 81,000 cases so far this year. That's about 3 times the number of cases that were reported in 2018. So, yeah, a lot of dengue in Southeast Asia so far. Now, when you think of mosquito-borne diseases in Africa, dengue doesn't typically come to mind. Typically, you think of malaria. But in this is actually a 4-year-old blog post in the CDC, July 2015, entitled Unveiling the Burden of Dengue in Africa. And it kind of lays out some numbers for us. It says, although 70% of infections were predicted to have occurred in Southeast Asia or South Central Asia in 2013, the next most affected region, 16% of all the cases, were in Africa, followed by the Americas at 14%. The large estimated burden of dengue in Africa came as a surprise to some, since dengue is not often diagnosed or recognized to be a risk in Africa. And it says dengue is hard to diagnose in Africa. And there are several reasons why dengue has limited recognition in Africa. And I'm assuming that this is still an accurate statement. First, the lack of laboratory-based diagnostic testing leads to many patients not being diagnosed with dengue. This can be perilous because without early diagnosis and appropriate clinical management, dengue patients are at an increased risk for poor outcome. However, in order for a clinician to request dengue testing, they must first be aware of the risk for dengue. This awareness usually comes in the form of a positive diagnostic test result. Hence, without testing, there is limited clinical awareness, and without clinical awareness, there is limited testing. So, yeah, a vicious circle in Africa. But clearly, we know that there is dengue in Africa. And looking at the latest World Health Organization Africa report, just from about a week ago, if you go through the report, there's a number of countries that are reporting dengue outbreaks. And the one that really stood out to me was what's going on in Tanzania. And to date, they've had about 4,500 dengue cases and a handful of fatalities. And it looks like the bulk of the cases are being reported out of the capital city of Dar es Salaam. But yeah, there is dengue fever issues in Africa. Now, a little bit about dengue epidemiology. This is from Outbreak Observatory from Johns Hopkins, and they say dengue is characterized by flu-like symptoms, including high fever, headache, joint pain, and rash. It is spread by the bites of the Aedes aegypti and Aedes albopictus mosquito. While other diseases including Zika and chikungunya are also spread by Aedes aegypti, dengue is considered the fastest spreading vector-borne viral disease worldwide. Generally, symptoms begin within a week of infection and can last between 3 and 10 days. Infections can sometimes cause potentially lethal complications, including dengue hemorrhagic fever and dengue shock syndrome. Dengue can be caused by dengue viral serotypes 1 through 4, but infection with one serotype does not provide any immunity against infections caused by other serotypes. In fact, subsequent infections are actually associated with an increased risk of developing severe dengue disease. This key detail is important to note when discussing challenges facing dengue control programs. Compared to just 9 countries reporting severe dengue epidemics prior to 1970, dengue is endemic today in more than 100 countries globally. So yeah, it's a big, big problem. And lastly, let me close with this. I don't know, 5.5, 6 years ago, back in 2013, researchers actually identified a 5th dengue subtype. And this was the first time that's been done in 50 years. And it says this finding could add to another challenge to vaccine development. The subtype was identified during screening tests on virus samples that were collected during an outbreak in Malaysia in 2007. The findings were presented by researchers from University of Texas Medical Branch in Galveston. The researchers' analysis suggested that the virus was different from the current 4 subtypes, and their sequencing tests found that it was phylogenetically distinct. So, yeah, so there is a 5th subtype. I don't hear much about it anymore, but this was big news back in 2013. Anyway, so that's kind of a picture of what we see with dengue worldwide and some specifics on what we've seen so far in this first 6 months of 2019. And clearly, we can see for sure the Americas and Southeast Asia are definitely reporting increased cases in the first 6 months. Okay, well, if you like this video, go ahead and share it with your friends. Comment below. You got something to say about dengue fever? I'd love to hear about it. Subscribe to the program, and I'll see you next time on the next Infectious Disease News Brief.
And don't forget to check us out at the website, OutbreakNewsToday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.